The Center for Public Policy and Health is a research center in the College of Public Health here at Kent State University. Over the past 10 years or so, we've secured about $12 million in federal, state, and local funding to do mostly projects focused on the early detection and prevention of substance use and mental health disorders.
We use social media and the traditional epidemiological data to create a dashboard which going to provide real-time monitoring of various social media activities, in the future also dark web. We have the traditional epidemiological data pulled in from various government agencies, so partner organizations, claim data, hospital emergency admission data, and police crash report data. We are using the data to inform and improve public health. So on one side, the dashboard will allow government agencies, various organizations to watch the pandemics in a real-time fashion, and they can also analyzing the data in real time. We are also using the advanced artificial intelligence and machine learning models to be able to predict the pandemics.
With the Kent State University Wellness Survey, we were able to collect data directly prior to the pandemic and then directly after. The week before, the president of the university made the announcement that classes were going to be canceled and life as we knew it at that time was going to change for a bit, and then compare that to the week directly after that announcement. Specifically, the data we were able to collect was about student alcohol use, so the frequency and amount of alcohol use, as well as a number of psychological variables like anxiety symptoms, depressive symptoms, perceptions of social support. What that allowed us to do was very quickly act on that data to analyze the data and understand the relationship between those variables. What we were able to find is that if you were experiencing heightened levels of anxiety and depression before the pandemic, that was related to a significant increase in alcohol use once that announcement was made and once daily life really changed quite a bit. We were able to report them very quickly and begin to plan and prepare for what would be done on campus here, but also disseminate this information across the country and begin to see a pattern of similar results come in, and at a almost national level be able to begin to have a conversation about what's changing in primarily college populations.
We know that if we can detect those things early and provide intervention, then the outcomes are better. Kind of the society that we live in now, with everybody having a cell phone or having a wearable device that is providing lots of health information and lots of other types of information, and then all of the social media that's available to us, being able to study that data to use it to better deal with mental health issues and substance use issues, specifically being able to detect them early on. The center is working to develop services and products that kind of fill a gap and have broad appeal both internationally and nationally. For example, with our mental health gatekeeper trainings, we found that with providing that to teachers in schools, a lot of the programs that already existed for gatekeeper trainings were too long or focused too much on like one specific topic. And so we've had to develop our own training so that we can implement this in the schools and it actually fits and it can be used by the schools and utilized.
The Mental Health and Recovery Board of Portage County is collaborating with Kent State University and the College of Public Health on a large mental health training grant. And we're really excited about it because this is giving us a wonderful opportunity to get out and do a lot of suicide prevention trainings for our community and for our teachers in public schools in our county. 50% of our youth reported to say that they have been struggling, that they've felt sad and hopeless over a 2-week period where they haven't felt like doing their normal daily activities. And that's up from 32% who said they felt sad and hopeless just back in 2019. We really feel it's important to equip a community with the tools they need to help others.
CHC Addiction Services is collaborating with Kent State's public health through a grant that we have through the federal government in order to expand treatment services for behavioral health care, people that have addiction and mental health issues, and specifically so we can provide more medication-assisted treatments. We know from just researching our own clients that about 85% of people who are able to get on a stable dose of medication for opiate use disorder are able to stop using illicit drugs within 90 days, which we're really excited about. So this grant allows us to expand treatment and to provide other additional services that may not traditionally be covered, things like childcare, ID, transportation. Kent has researchers. They can come in, do research when somebody starts treatment, in the middle of treatment, and then after they're done with treatment to see what was effective and what helped.
Expanding substance use treatment or mental health treatment, we don't provide those services through the center, so we have to collaborate with agencies that do. And so these agencies probably wouldn't secure that funding because they don't have the resources to do that. They also usually don't have the resources to manage large projects. So we take care of that side of things, and they take care of the service side of things. If those collaborations weren't there, those services wouldn't be able to benefit communities. And so I think we want to continue to grow that side of the center and those collaborations.